few months ago, we at hospital, we get this patient. He's a fairly elderly man. He's a trader. Of course, he comes, he's very weak, he has a fever. He complains like he had developed a fever for the last 3 days. Of course, it came with muscle pain, joint pain. He had tried to take some painkillers. He had even a headache. Unfortunately, despite all these things, he was not getting the response he wanted. In fact, that very day, the reason why he came to hospital was because he had developed vomiting. Given that he's a trader, we tried to ask him, have you been, in transit in the past maybe few weeks or months? He reports that he had been moving around East Africa. That raises our index of suspicion. Remember, that is around the time when been reported an Ebola outbreak in DRC. So we asked him, how about DRC? He's like, yes. So if you've been in the tropics, you all know that there are diseases in the tropics that mimic each other. For example, malaria, salmonellosis, even this Ebola outbreak, they all have similar symptoms. They will all give you fever, they will all give you headache, muscle pain, generalized body weakness, all these things. So we are like, okay, so at that point we have our index of suspicion high, we gear up, we put on our necessary PPEs, we isolate him, we inform the caretaker that he's not to, we give him this room which has all that he will need, the toilet facilities and all these things. And then we start trying to work him up. We take off the blood samples, check. In fact, we asked him also, had he taken any other medication before coming? Because for some, it would even narrow our view. For example, if someone has taken the anti-malarial treatment and they are still weak, clearly malaria could be down on the list, or if he has taken the typhoid treatment course. So we ask him and he's like, no. So at that moment we initiate treatment, we do a quick MRDT, thankfully it's positive. We start him on anti-malarial treatment as we send other samples to other labs for other tests. So after a few days, our patient improves with the virus care, and later on, even with the samples that were taken for checking, we find out that actually that he was negative for Ebola. So we discharge him and life continues. So that brief story tells you that Ebola mimics a lot of familiar diseases that most of us may be knowing. It will give you the typical symptoms that you know. We've heard of the bleeding and what have you, but usually that's signs of an advanced patient. In the initial few days, you may not start with bleeding. So in this video, we are going to see what is the current state. As we all well know, on 14th May 2026, the World Health Organization declared the 17th Ebola outbreak in DRC. And globally, this was the 35th. And it later declared this a public health emergency of international concern. Why does the WHO mention all these things? It wants, one, to inform you it's a high formal alert to tell you that the disease is here and it has rapid spread. For those diseases with rapid spread. So that's Ebola. That's why it was declared. So then also it's an alert to call for a global response. For example, the various regions, if you're a neighbor to a country that is affected, very soon you can also be a victim. So that's why WHO gives out all these warnings. So this outbreak started in Ituri province. It spreads locally within DRC to North Kivu, South Kivu, Tishopo, Howlet. There's another province there. So it spreads in 4 provinces. And within a few months, realized that it had actually spread to Uganda. 20 cases were noted in Uganda and 2 deaths. Thankfully, in Uganda it was contained, and by 28th July, Uganda was reported to be Ebola-free. That was after a 42-day surveillance since the discharge of the last Ebola patient. So that means we remain with only Ebola in DRC, and as per today, 4,381 cases have been noted with 2,011 deaths. That's quite a big number compared to the previous outbreaks. So in this video we see, one, why does this thing keep coming up? Would expect why the 17th outbreak? Why isn't the solution available after 2 outbreaks, so one? And then we want to remind ourselves about the signs and symptoms, and then what we can do, or what the governments and these health organizations are doing to protect us. So Ebola keeps coming up simply because, you see, as humans, we keep advancing given the conditions presented before us, even the germs and the diseases. when you introduce medication, they also evolve or advance. So, and they do that by coming up with strains. The previous strains, we had the Sudan strain, the Zaire strain. This time around, this was the Buju strain, which is different from the past strain. So you see, this was an evolved version and it was rapidly spreading. Then that is one of the reasons, yeah, the changing. Then for some regions like now, like DRC, its biggest part is rainforests and it's Ebola. Its major harbor are bats, fruit bats, yeah. They're the ones which harbor it. Then through their saliva and droppings, they spread it to the animals, and these animals are usually hunted animals, things like antelopes, yeah. So they are hunted animals. That's how they end up with humans, or even humans interfacing with droppings, humans interfacing with carcasses of dead animals, because Ebola kills these animals too. So the geographical location of some countries puts them at a risk. Then the third reason is because usually Ebola has been found to be that disease which you will treat, but after some months or after some time it reactivates. For example, it comes up again. Yeah, it's not something that treats and it disappears once and for all. It's reported that for some survivors, it harbors itself in some regions of the body. For example, the testes, the eyes, it hides in those sterile places of the body, and after some years it reactivates. So that's the reason majorly. The vaccines have been come up with, but the vaccines are for the Zaire strain, yet this is the Buju strain. So you find that the other vaccine can't work with this particular strain. So reminding ourselves about the various signs and symptoms of this Ebola, just like any other disease, when it enters the body's immunity starts fighting. And what shows that the body is fighting, you start developing high temperatures or fever, start developing muscle pain, joint pain, headaches, generalized body weakness. All these are just signs that the body is fighting. And this mimics, we can visibly see malaria, typhoid in the tropics. Usually presents exactly like that. So that means if you're this kind of person who thinks you may have been exposed and you have this, give them the attention that they deserve. So it's later in the advanced stage, after this Ebola has hit our liver. Remember, the liver is the one which gives us some clotting factors, yeah, in the blood. So when it hits our liver, it destroys it. You'll find that now the blood cannot clot. That's how bleeding happens. You start bleeding from whatever area that bleeds. Even if you get a prick, you will not clot. Yeah, it's after the liver has been damaged. So those are the ones. What has been done, or what can we do on an individual basis? Of course, when some areas are quarantined or some areas are marked as danger zones, we have to avoid them. Yeah. Then secondly, for some people, if you have a relative and someone within your community who has been confirmed to be sick, of course you have to avoid them. Majorly it's isolating the sick ones, and then those who are not sick, avoiding them. Be avoiding interacting with bushmeat, all these things. But sometimes it's unavoidable. So vaccines, yeah, the various health organizations are working on vaccines that can help us with this problem. A multivalent vaccine, yeah, not one that targets one strain, rather one that targets multiple strains. Just like cervical cancer, those HPV. Currently is it Gardasil? Yeah, all the vaccines for cervical cancer target multiple strains, yeah, of HPV. We have HPV 16, 18, and what have you. So even with Ebola, we want to do the same thing. We get a vaccine that targets multiple strains, yeah. There it's easier to know that you vaccinate the vulnerable populations and then we are safe. Then the other thing we see is, of course, early detection and high index of suspicion when dealing with patients of Ebola, because if you don't notice early, this is one disease that spreads very quickly. Then, of course, the other thing is following up the Ebola survivors, because we've seen that some of them, Ebola hides in the body and then comes up again in the future. So WHO is trying to follow up all these survivors and then try to monitor there are some tests that keep being done, yeah, to make sure that they don't, that this doesn't come up again. So far, hopefully, in DRC, of course, there's a global response. It's not thrown to DRC alone, and we are hopeful that with all these added hands, they can also contain it, just like the previous outbreaks. Yeah. Yeah, so basically that is it. I encourage you to subscribe for more of such videos and timely updates, yeah, about this kind of things. Thank you so much.